glucose. So I verified the order. Now I'm going to verify this is the correct patient by looking at the armband. Can you tell me your name and date of birth? Okay, matches the armband. So now I'm going to perform hand hygiene. Okay, now I'll put my gloves on and ask my patient to wash and dry their hands. Patients wash and dry their hands. I'm going to take the AccuCheck machine, turn it on, and then place a strip. Now I'm going to wipe the patient's finger with an alcohol swab. Dry. Okay, now that that's dry, I'm going to poke their finger with the lancet. 1, 2, 3. Okay, I'm going to squeeze. Now I'm going to wipe away the first drop of blood. I'm going to squeeze more blood. I'm going to put the strip blood. Okay. The results have displayed on the screen. I'm going to turn the meter off and disinfect it. Okay, now remove my gloves and wash my hand and document the results. Okay, I'm going to be mixing and administering insulin. So I'm going to compare the physician orders with the MAR. So I have an order for 10 units of regular insulin and 12 units of NPH. Then I'm going to identify the patient. Can you tell me your name and date of birth?
Gordon Stevens, 5/12/99.
Okay, and that's right. Now I'm going to perform hand hygiene. And put my gloves on. Alright, and we have already checked her blood glucose. Can you tell me where you got your last injection of insulin? She got her last injection in her left arm, so I'll do this one on her right arm. Okay? Okay, I'm going to assess the site. Skin looks good. Okay, so I pulled my insulin. I have the NPH and regular. I'm going to compare it to the MAR, check an expiration date. Okay. I'm going to roll the vials. I have my insulin syringe. I'm going to begin by cleaning the top of the NPH cloudy. I'm going to clean it with the alcohol swab. I'm going to take my regular insulin and clean the top of that with the alcohol swab. I have my insulin needle. I'm going to take the cap off, and I need 12 units of NPH, so I'm going to withdraw 12 units. The insulin syringe of air. Okay, I'm going to inject 12 units of air into the NPH insulin. Okay, I'm going to withdraw the needle, and I have 10 units of regular insulin, so I'm going to inject 10 units of air into the regular insulin. Okay, now I'm going to withdraw 10 units of regular insulin. Now I'm going to withdraw withdraw 12 units of NPH insulin. I'm going to put the cap back on my needle. Okay, I'm in the patient's room, so I don't need to label the syringe since I have my vials here. And I'm going to verify the dose with a second nurse. Verify this to be 22 units. Okay, she verified this 22 units. Now I'm going to perform a third check at the patient's bedside. Tell me your name and date of birth.
Jordan Stevens, 5/12/99.
Okay. And then we're going to verify. I do have 10 units of regular insulin and 12 units of NPH insulin. Now I'm going to tell the patient it's 30 minutes before lunch, so we're going to head and give you your insulin injection in your right arm. I'm going to clean the patient's injection site with the alcohol swab. Okay, allow that to dry. And I'm going to take my cap off and pinch the patient's skin. 1, 2, 3. Okay. Now I have my gauze I'm going to put. Okay. All done. I'm going to dispose of my needle into the red bin and remove my gloves and wash my hands and document. Okay. I'll be performing an IM injection. First, I'm going to compare the healthcare provider order with the MAR. The healthcare provider has ordered 3 milligrams of Ketorolac, which is in 3 milliliters. So I have my Ketorolac right here. Okay, I'm going to identify the patient. Can you tell me your name and date of birth? Okay, now I'll perform hand hygiene and put my gloves on. So I have compared the medication with the MAR. It's correct medication, and I checked the expiration date. Now I'm going to clean the top of the vial with the alcohol swab. Okay. I'm going to open my syringe and put on a blunt needle. Okay, this is my blunt needle. Okay, and it's going to be 3 ml. It's going to be 3 milliliters, so I'm going to insert 3 milliliters of air into the vial. Okay, now I'm going to withdraw 3 milliliters, maintaining sterility. Make sure we don't have any air bubbles. Okay. I'm going to take my syringe off. Okay, I'm going to take the blunt needle off and prepare the needle that we're going to inject the patient with. Okay, I'm inside the patient's room, so I won't need to label the syringe. I'm going to perform a third check at bedside. Can you tell me your name and date of birth? Okay, you tell me their name and date of birth. This is going to be an IM injection. It's going to go into your hip. And this is Toradol. Okay, I'm going to clean the patient's injection site with alcohol swab in a circular motion. Okay, I'm going to take the cap off my needle. All right, and I'm going to inject it into the patient's skin at 90 degrees. Okay. Slowly administering the medication. At 1 milliliter per 10 seconds. So it'll be 30 seconds total. Okay, I'm going to leave the needle in place for 10 seconds. All right, I am taking the needle out, putting the safety cap on. I'm going to dispose of this in the sharps container. I'm placing alcohol swab on the injection site. Okay, now I'm going to remove my gloves. I'm going to document the procedure and document how the patient tolerated it. When giving a patient medication, you want to make sure you go through the 6 rights of medications administration, which includes the right patient. So you want to make sure that the medication you're giving is for that patient. You want to make sure it's the right medication. So even if you pull it from the Pyxis and it says that it's that medicine in the drawer, you want to look at the medication and compare it with your MAR, make sure that is the medication you're giving. You want to make sure it's for the right indication. So if you have an order for a medication and it's for one thing, but you think you're giving it for another, you just want to clarify that with the doctor. You want to make sure it's the right dose. So sometimes, like if you have a 25 milligram tablet, and that's how it comes. If the provider orders 12.5 milligrams, you want to break that in half. And make sure it's for the right time. So if a medication is due at 9, you can give it between 8 and 10. And then you want to make sure it's the right route, rather that be oral, IV, through NG tube. If a patient has a PRN medication for pain or nausea, and they ask for that medication, you want to ask them what their pain is, 0 to 10, and then you want to document that. You want to give them the medication, and then you want to make sure you check back with them and make sure the medication has been effective, and then you want to document that the medication has been effective. Okay. And then we're going to talk about the signs and symptoms of hyperglycemia. So that is high blood sugar levels. So the patient will have an increased thirst and dry mouth. They will be needing to pee frequently. They'll be very tired. They could have blurred vision. And then the signs and symptoms of hypoglycemia, which is low blood sugar, be a fast heartbeat. They could be shaking, sweating, and they could be dizzy. There are a few different types of insulin delivery methods. You could use the syringe or the pen, which that's what I've used most commonly. An insulin pump or an insulin inhaler. You just have to be 18 in order to use the insulin inhaler. And the insulin pump could be attached to the person, like a Dexcom, I believe. But in the hospital settings, I've seen the syringe or the pen.